so that we can capture this information and refer back to it at some point. But one more minute.
Well, I'm waiting for my partner, one of my many partners.
Yeah. It may be popping on now. There she is, right on time.
Always.
All right. We're going to go ahead and get started. It's paining me. I'm Air Force. I'm all about on-time takeoff. So we're going to get right into it. People are jumping on. And it's great. It's great that people are jumping on. And I want to share that in partnership with Serving Together, the Howard County Office of Veteran and Military Families, the Howard County Health Department, and NAMI Howard County, also the Howard County Veterans Collaborative. I mean, this is an informal, regularly occurring meeting between service providers and community organizations. So this is mainly the communities. I am and we are the administrative backbone. So this is whatever you want it to look like, but we're supporting it. We're providing the infrastructure, the platform, but this is your collaborative. We just live here. So without further ado, I'd like to do a quick introduction of myself. Some of you all have known me for a while. Some may have not. You may be wondering, okay, where is this guy coming from? I'm the new program manager for Central Maryland. That includes Howard County, Anne Arundel County, Baltimore, and Harford counties as well. So at this time, I like to go around the horn. Quick 30-second introduction, 30 seconds. Name, title, organization, and here's the question of the day. What is the one big thing that you plan to do this summer? So again, name, title, organization, and what is the one big thing that you plan on doing this summer? So we're going to start with Rochelle and then Nicole.
You would have picked me first, right?
Yep. Yep.
Good morning, everyone. My name is Rochelle Hazard. I'm the new Assistant Vice President and the Executive Director of Tower Cares Foundation and Tower Federal Credit Union. So one big thing I'm doing is in 14 days, I will be on a cruise out of New York. So.
Oh, nice. Nice. Perfect.
To celebrate my birthday, by the way.
Okay.
Happy birthday.
Yeah. Happy birthday. Fantastic.
21. It's always good to be 21.
Okay, so now we're going to go with Nicole and then Stephen.
Hi, good morning, everybody. Nicole Doremus. I am the Assistant Vice President of Veterans Programs at University of Maryland Global Campus. Let's see, one big thing that I will be doing this summer. So next month, my youngest sister is getting married up in Pennsylvania. So I will be headed up there for the wedding.
Awesome. Thanks for sharing. Now, Stephen and Tom.
All right, good morning, everybody. My name is Steve Pfeiff. I'm with the Dundalk Vet Center. I'm the Veterans Outreach Specialist here. Kind of just got back from my big thing this summer over at a lake out in Virginia with the family. And hopefully doing another fishing trip for the White Marlin Open come August.
Nice. Sounds like fun. Tom and then Lisa. I have two Lisas on here. So Lisa Terry.
Good morning, everyone. I'm Tom Ford. I'm the Northern Regional Employment Rep for the Maryland Department of Labor Veterans Program. And the big thing I'm working on this summer is, sounds like Steve is a fellow fisherman. I got to get my boat ready for the fall fishing season down here in the on the Chesapeake Bay.
Awesome. Thanks, Tom. Lisa Terry and then Chloe.
Hi, I'm Lisa Terry. I'm the manager for the Howard County Office of Veterans and Military Families. And in mid-August, I'm taking my oldest to Penn State University, start his freshman year. So I'm, gonna be a little weepy that day.
Yeah. It sounded like you were going to be weepy just a second ago. So. It's okay. He'll be all right. Next, Chloe and then Lisa Sowers.
Hi, my name is Chloe Mcgeehan, and I'm interning with the health department this summer. So sort of helping out with a variety of things, but focusing mostly on mental health. And one big thing that I plan to do this summer is complete this internship and get ready for my first year in college. I'm going to Duke University and super excited.
Oh, wow. That's awesome.
Thank you.
That is awesome. Lisa Sowers and then Rick Reed. Is Lisa still there? Oh, there she is. You're on mute, Lisa. There you
That
go.
was on purpose. I'm Lisa. I'm a therapist and equine specialist in Howard County, working with veterans. And we just got back from a vacation at Lake Chautauqua, New York.
Nice. Thanks, Lisa. Rick and then Ann.
Good morning, everybody. This is Rick Reed with Maryland's Commitment to Veterans. We're part of the health department. I'd keep my camera on, but I'm doing 2 meetings at once here. So Angel Powell used to sit in here on this central meeting, and she's no longer with the organization. I'm covering down for central. I am typically in the southern region role, but until we get somebody new in here, I'll be sitting in the meetings and double meeting up, here. So I'm a regional resource coordinator, and if you have anything veteran related, just you send it my way. Okay.
Fantastic. Thanks, Rick.
Big thing this summer. We just got back from Mexico, but we plan to go to the Dominican Republic. So yeah.
Oh, wow. Nice. My wife was just talking about DR this morning. So
Yeah.
I have to talk to you once you get back. Next, Ann and then Cynthia.
Good morning. Can you hear me?
Yes.
Great. I'm with the Weinberg Foundation, and a big thing this summer is family trip to New Brunswick, Canada, to see the amazing tides in the Bay of Fundy.
Nice. Another place I need to go to, Canada. Awesome. Cynthia and then Kadena.
Morning, everyone. Cynthia Cavallari with the Federal Executive Board here in Baltimore. One big thing, several little things, but hopefully can get maybe a trip out of this if I can get all the approvals. Y'all know how it is in the government to go overseas. So hopefully I can get this thing approved and be on my way next month.
Awesome. Thanks, Cynthia. Kadena and then Ro.
Good morning, everyone. Good morning, Kadena Williams with Shepherd Pratt SSVF Housing Program for Veterans. I think the other part of the question was plans for summer.
Yes.
Okay, so I will be taking vacation on Thursday. We'll be going to Myrtle Beach.
Nice. Awesome. Thank you. Ro and then Yolanda.
Hi, Ro Rogers Bonacorsi, Director of the Bureau of Behavioral Health, Howard County Health Department, Local Behavioral Health Authority for Howard County. What am I doing big this summer? We're going on a family vacation with a couple generations to Florida.
Nice. Thanks for
Thank
sharing
you.
that, Ro. Yolanda and then Leah.
Good morning, everyone. Yolanda Rayford, Chapter Director of Blue Star Families, the Baltimore and Chesapeake region. I am just trying to get through the summer. I am the mother of the bride, and so the event is on September 25th. My goal is to have everything ready by the 15th of August, and so far, fingers crossed, it's going exceptionally well.
Awesome. Good luck with that, Yolanda. Last but not least, Leah, unless somebody else jumped on. Leah, you're next.
Good morning. I'm Leah Bolka. I work at the Howard County Health Department in the Bureau of Behavioral Health with Ro. I'm the Suicide Prevention Coordinator. And this summer, I just got back from the Bahamas, but I've got a lot going on. I'm going to see my favorite soccer team, Arsenal FC from England, play on Saturday in Baltimore. So looking forward to that.
Awesome. Thank you. Thank you. And I've gotten a couple of messages in the chat pod. Thank you so much. I am going to leave the best for last. the man of the hour. He enlisted in the United States Army in January 1967, went to Vietnam with the 4th Infantry Division in 1968. He began his career in the public employment and training field in 1978. He was a disabled veterans outreach program specialist, employment interviewer, employment specialist, and local veterans employment representative. Also worked for Veterans Employment and Training Services, or VETS, of the U.S. Department of Labor in Tallahassee. Also the VETS National Office located in D.C. He was the Director of Veterans Employment and Training located in Baltimore, Maryland as well. He was a project lead for the Incarcerated Veterans Transition Program on a nationwide basis. He retired from the U.S. Department of Labor in 2011 and was appointed to the Maryland Veterans Commission in 2012 by the governor and reappointed in 2018. He was also appointed to be a trustee on the Maryland Veterans Trust Fund in 2012. He volunteers for Serving Together and the Maryland Center for Veterans Education and Training. Comrades, please join me in welcoming Stan Seidel.
Well, thank you very much for that long drawn out introduction. I've been doing this for quite some time, so I appreciate the opportunity to talk and meet with everybody. Before I start, I just need to make people aware I'm going to be going to Long Beach Island and spend some time with my grandchildren. So I'm looking forward to that vacation. Every day for me is vacation because I'm retired. And I do what I do because I do care. So we're going to talk about something that I've been involved with. Number one, I want to make people aware that the trust fund has given out more money this year than any other time. Please be aware of the Maryland Veterans Trust Fund. Look it up on the Maryland Department of Veterans Affairs website. We've got a significant amount of funds still available to help veterans and widows. Conversely, I'm a commissioner with the Maryland Veterans Commission, and that's how we're going to be talking today. I'm not representing the commission today. I'm representing Stan Seidel, a veterans advocate. And I have with me Cynthia Cavallari, who is also working with us. So let's start number one. 5 years, if not 6 years back, when I went to a summit that was put on by the Aberdeen Proving Grounds dealing with opioid abuse. There I met Cynthia Cavallari, and also I met Dr. Cynthia Macri. Dr. Macri somehow convinced me that we should do a committee which was called Combating Opioid Abuse Impacting Maryland Veterans and Their Families. And for 2 years, up until COVID really hit, we looked into the issue and we came out with several recommendations. And we were fortunate enough that those recommendations were taken to heart by the secretary, who then transitioned it over to the Opioid Operation Command Center. Then COVID hit and everybody got placed into a position of what's going to happen next. And for a long time, the committee, and I'll go into that in a few minutes, Cynthia is going to help me with the PowerPoint presentation, basically formed another committee, which was combating substance misuse impacting Maryland veterans and their families. We did this because we were reading article after article about how substance misuse was impacting greatly everybody. And there are a number of reasons why it was occurring, of course, isolation being the number one reason. But just as importantly, was the not sufficient amount of people doing drug and alcohol counseling or qualified. So based upon that, we asked that there be a standing committee. And I'm now going to talk to you about some of the things we discovered as a subcommittee. But again, I'm going to say it 3 or 4 times. I am not representing the Maryland Veterans Commission. I'm not representing the Department of Veterans Affairs. So this was done in Montgomery County, but I figured before I even say that, I want to, number one, thank Lisa Terry and several of their individuals who helped us in the very beginning of this project. I mean, you guys are so far ahead of everybody else. It was amazing to me. But I want to make you aware, this is not a blame game. Please, this is not an opportunity to blame. This is an opportunity for us to say, how do we move ahead and deal with this issue? Because some of the things we found were quite disturbing. Next slide, Cynthia, please. So these were the members of the subcommittee: Dr. Macri, Rick Lane, Penny Collins, Cynthia. We had a representative from the Stephen A. Cohn. Right now it's Grace Caulfield. Prior to that it was Annika, the director. Jason Marshall works with us from Serving Together, and Kim Kalari from the Baltimore station. So as you can see, we have a number of people who I consider to know a lot more than I'll ever know about dealing with substance misuse. Next. Before we even started, we got together and we said, we have to identify what is our mission, what's our objective. And number one was to increase the marketing and availability of service for Maryland service members and their families to address the misuse, abuse, and diversion. We've got to get the word out. And I know you in Howard County are doing an excellent job, but you'll be surprised at how few veterans know where to go. You'll be surprised at how few service members are actually going and getting treatment. And even if we do the marketing, we have to identify the service providers. When we refer people, we want to make sure they know where are they going. And we're going to propose strategies to increase the number of qualified counselors. And I'll let Cynthia later on talk about the development of metrics to capture data to monitor awareness and assess impact. Next slide. So first thing we did was we talked, and believe it or not, one of the first people we connected with was Lisa Terry and the group to find out more about recovery and treatment programs. And we actually went to visit recovery and treatment programs. We also decided we had to visit not just one VA medical center, but all three, because if you know it or not, Maryland is serviced by 3 different VA medical centers. Lastly, we also had to talk to and try to find out more about the military installations and military alliances and the Maryland Department of Veterans Affairs, because the job of the commission is not to tell anybody what to do. It's to advise the secretary of issues that are impacting Maryland's veterans and their families. That's what we were doing. Next slide. There we go. So we had to identify providers, which includes the U.S. Department of Veterans Affairs. We talked to the Substance Abuse Mental Health Administration, SAMHSA. We still are connecting with the Maryland Opioid Operation Command Center, and we talked to the Maryland Department of Health and Behavioral Health Systems. We also talked to a lot of nonprofits like Headstrong, Stephen A. Cohn Clinic, the Baltimore Station. We went to the Turk House. We are connected with Serving Together, and I volunteer with the Maryland Center for Vet Education and Training. And there are other recovery and treatment programs that we discussed issues dealing with it. And we were surprised at some of the information. Go to the next slide, and I'll see if I can get to the meat of this. So we wanted to talk about, before I go into this, I want to go further into what we found out. We found out that there was some lagging, specifically the lag at the time a veteran went into and requested assistance. For those who don't know it, Maryland is great. 40% of the Maryland veterans are actually enrolled in the VA health system, which is better than, I'd say, the vast majority of the states. But the question you got to ask yourself is, what happened to the other 60%? How are they getting treatment? What are they doing? When we visited some of the and talked to some of the recovery and treatment programs, we found out that a lot of them didn't even know if they're a veteran unless they were requesting to receive payment through Medicare or Medicaid. I'll say it that again. A lot of times they were treating individuals and didn't know if they were a veteran unless they're receiving Medicare or Medicaid. We also talked about translating relevant experience, because we were told repeatedly by different people they were having concerns with finding qualified counselors. And I'm so glad Headstrong came into and has been working in the state of Maryland, which helps us bridge some of the issues, the gap. You also said that college and university can help us bridge the gap. We're talking about navigating certifications with the Maryland Department of Veterans Affairs Licensing Regulation. One of the ways of doing that is going to the military installations, talking to corpsmen, medics, and psych techs, and being able to say, if you're going to get out of the military, how about thinking about working with the recovery and treatment programs? And how about the colleges working with us to reduce the amount of time to become fully certified? Again, we talked about Headstrong to help us leverage unique approaches. I don't know if you're familiar with Headstrong. I'm sure they've already talked. If they haven't, they should. I think they're doing an excellent job. Next slide. So I'm going to let Cynthia talk a little bit about capturing data to monitor awareness and impact.
Thanks, Dan. So part of the conversation with this particular, the fourth focus area is how do we show that these efforts are contributing to actual tangible awareness and referrals, are effectively contributing to referrals and making sure that we're meeting those three previous focus areas. Can we take what we're doing from one-on-one transactional, one-time information sharing to a place where it is more strategic or more operational? So where that information is not only being made to people who know how to ask for help, where to ask for help, who to ask for help, but it's accessible by those outside of our immediate or our known contacts or our very common kind of intake or referral systems. Everybody is already working in these fields. Like Stan mentioned, everyone's already doing the work, all the work that it takes, and the collaboratives like this, and how do we turn this into concerted, intentional efforts? If we're able to communicate this information to those points of intakes or to incorporate it as part of respective referral processes and staff training, this becomes part of your Rolodex, part of your SOPs, part of your checklist, but hopefully also feeds into a database of available resources. And if so, are we able to quantify the about is but a reporting mechanism with predetermined data or info where all of the data points talk to other data points across the various systems and platforms, while we keep that administrative burden low, but the data remains meaningful, impactful, and worthwhile. So leveraging what we're all already doing in the infrastructure you've already built with the government and the non-government partners. And what we're talking about, this is not a lofty goal. This is not working in the abstract. This is already happening. Work wide or assist conversation too is Stan and the working group doesn't have all the answers. Y'all do. We all do. Collectively, we can fill in those gaps and build those bridges. So how do we leverage our respective communication methods, the newsletters, the social media, the emails, the texts, all those digital marketing tools that already monitor activity and performance of who's being reached and how they're being reached. And I know that I think when we did a presentation at Western Maryland, maybe Stan, someone from the vet center said, I already do this. It's so easy just to turn information over. We have tabling events. I have flyers of all the other providers, not just the vet center or the VA. I have to report up, to my headquarters. How many people did I see? What were the groups that were there? So I will pipe down and let y'all tell us some more, give us some feedback and any questions you might have. But please, please, please feel free to use this time to also share what you're doing that makes sense, that is scalable, that is already integrated with someone else on this call or in the network that's already working.
But before we turn it over to a group discussion, One, as I told you, there's findings and recommendations. Capture and reporting veteran status is becoming crucial. I already said that some of the recovery and treatment programs have no clue. I can specifically say from my own experience, if an individual is ODs and or is going to the hospital, once the hospital treats them, they are referring them back out. We have no idea, they have not captured whether they're a veteran or not. So that's one aspect we need to talk about. And that is the first responders as well as the hospitals. When they are connecting with an individual, how will they be able to, can we help them identify if they served in the armed forces of the United States? Please note, I didn't say veteran. I said, did they serve in the armed forces of the United States? Because unfortunately, a lot of people say, are you a veteran? And some people don't say they're a veteran, especially if they're a service member. We want to reduce the wait times. We found out, and we requested data, and it's in our report, that it could take up to 3 weeks for an individual to be enrolled in a program. Listen to me, up to 3 weeks from the time I call, and I'm not talking about the vet center program because they will immediately take anybody, but I'm talking about the medical centers. We actually went out and requested specific timeframes. And we found out that some of the veterans who would come to them and request assistance, it might take up to 2 to 3 weeks for them to finally get enrolled in a program. Because the first thing they're going to ask them is, are you enrolled in the VA healthcare system? We also want to talk about connecting substance misuse programs across the sectors. And we want to increase the VA enrollment and marketing. That's what we want to do. We also found out some of the VA didn't know about serving together, didn't know about the cone clinic. And you think about it. I come in, I'm not just impacted, it's my family that's also being impacted. Yet the VA doesn't have the authority to handle, quote unquote, a spouse and or a dependent. However, there are other facilities that do, like the Cone Clinic can do, and will take care of family members. So again, this is the discussion we're having with you right now. We know you in Howard County are doing it, and we want to learn from you. What are you doing, and how do we spread the information out? Right now, Cynthia and I are working with another state organization, and we're looking at trying to put together a summit. And the summit's going to be broken down into 4 different avenues. One avenue is to reduce the time, is to have all the players, i.e. 25 to 50, talk about what we're doing and how do we help the individual who originally comes in, and how do we market so veterans and their families and service members and their families are going to come to the right place. 2, we're talking about the possibility of getting the colleges, and I have a couple experts on how to transition military personnel to hopefully respond to the challenge of finding and getting more qualified drug, alcohol, and mental health counselors. 3, we're talking about first responders, how to educate first responders. And then the third most important part, how do we follow up after the responder sends them to a hospital and or a VA? So those are some of the things we're talking about, trying to connect with a summit and having. Right now, we've been working hard at it, and I'm not going to give it up until we get that summit in operation, to be candid with you. If I can't do it in Maryland, I'll go to Virginia. I don't care, because it's all about how do we respond to this crisis. I don't know if you realize it or not, but some of the data that's come out has shown that the number of deaths has increased due to substance misuse, especially with the pandemic impact. It hasn't reduced. So are we doing the right? I'm not saying we're not doing the right thing. I'm just saying we need to do a lot better at what we do. Next slide.
And can I caveat that real quick, Stan? When we say summit, this is not a come in, sit down, get CPEs and webinar summit. This is stakeholder roundtables where we're breaking out into those groups and you're making the plans, you're making the commitments. We're walking away and saying, this is what we're going to do with the follow-up 30 to 60 to 90 to 180 days out. This is not a sit back and passive mode. This is we're making these agreements here so that we can bridge all these things together. Because I know when we hear summit, when we hear webinar, we kind of have that notion of, oh yeah, we go to summits all the time. No, this is putting in the work and rolling up the sleeves.
Okay, so what are we missing? What didn't we cover? What should we know about your groups and what are the next steps? And we're opening this as a discussion with everybody, please. And if not, I'll pick somebody. I haven't heard from NAMI. I would like to hear from NAMI because I know they do a heck of a job.
And I will say, when we did the Frederick one, Stan, I know that Jason Marshall had chimed in and said, hey, when you talk about how do we put this together, the referrals, the intake, all of this, and they said, we're doing this already, and it's scalable. And I see Christy nodding, so I'm just gonna sit there and go, Christy, what does this sound like to you?
Hey, yeah, absolutely. Oh, and I see Yolanda's hands up, but obviously, serving together, we operate a coordinated network of care. And so when you talk to Cynthia about, utilizing tools and resources we already have, obviously we utilize the Unite Us platform, which many providers across the area are utilizing. And we have the tools to be able to help navigate clients to appropriate resources. And obviously substance misuse is a really challenging one to find the most appropriate resources, because oftentimes it can be very expensive for veterans to be able to afford. While they could access the VA, not all of them are willing. And so, when we help them navigate to the most appropriate resources, sometimes it could be fairly far away from where their home is or their family, which makes it even more challenging for them to go into and get the services they need. And it's often long-term, treatment and care that they may need to help with the ongoing support. So, when it comes to serving together, we look for the best resource. And so we help them navigate wherever they need to go. And we have a database that utilizes, the referral platforms, and we have the ability to track outcomes and metrics associated with that. So the more that we can get organizations like yourselves in the network and utilizing it, accepting referrals, the more streamlined and quick we would be able to get folks to the right resources as quickly as possible. So yeah, I think Yolanda, you wanted to take it, so I'll turn it over to you.
Thank you, Christy. So I'm going to applaud, this effort. It is amazing. I know professionally, I've been contacted over the past 2 years about specific instances. So without going into a lot of detail, the Unite Us platform was instrumental in getting a referral, but more recently, I had to just stop what I was doing, pick up the phone and call a colleague at the Cohen Clinic and say, could you assist? I did not have time. And we went around and provided the service. Stan has sent me summit details. Blue Star Families is going to attempt to be a part of this as much as we possibly can. What is impactful for me is I liked what you said, Stan, if you serve, not just the veteran, because that is where we've been having an issue as we are trying to provide people with referral, because they just stop what they're doing. They hear veteran, they go, oh, well, and then if you ask the further question, you get a little bit more information. So thank you all for this. However we can support, please let us know.
Thanks, Yolanda. Yeah, to Christy's point about serving together, and Stan had mentioned earlier in the presentation, there were some folks we talked to that weren't familiar. So Stan said, can I connect you? And they said, yeah, we regularly, especially at the VA, is where they regularly have meetings where they're bringing outside organizations in so they know what's out there. So that was a simple, quick, easy fix to go, hey, here you go. Let's connect you. Let's make you aware. Now now you're empowered. Now how do you use this? And same thing, provider to provider, Stan. It's not a competition. It's
Right.
where can the needs best be met. Sorry, I saw you were going to say something too, Stan. I'll pipe down.
No, please. What we're trying to do is get the dialogue going. We're just bringing this out. You're not the only ones. We're going to the next place on our list. We're going to keep marketing until we get, hopefully, no more. At least everybody will know where to go if there's a substance misuse issue, whether it's the VA Medical Center, whether it's the vet center itself, whether it's the Cone Clinic. I don't care. I really don't care. I just want them to know where to go. And it's not just about the veterans and their families, which we're responding to, but it's also the service members. Remember, service members are also dealing with that issue. And the problem the service members have is they can't seek it right away because of fear of losing security clearance and or fear of promotional opportunities. But thank God we have the Cone Clinic. Thank God we were able to get Headstrong to be part and discuss this issue at the Maryland Military Installation Council meetings. So we've been fortunate enough to have a lot of connections, but there's never enough. And as long as I've heard and as long as I read about the fact that there is more and more people dying from substance misuse because of fentanyl, because of whatever reason, I don't care. We want them to be aware of where to go. Number one is the marketing aspect. So now we've got 988 coming out. Well, that's great. Let's see, 5 years down the road, 988. Okay, well, good. I'm really am glad that your 988's coming out. It's starting, I believe, July 16th, if I'm not incorrect. And that'll help. It's not going to be the only thing. I've always been an advocate, but I can't get it done. So I do fail occasionally. I know that's a hard thing for me to take, but I do fail. I always wanted to use shopping carts at the different Giant, Safeway, and put a little placard there saying, if you or your family are in trouble, please call 988. Now we can do that. So that's maybe something the community, you guys can think about. Can you get the Safeway? Can you get the Giant? Can you get the Walmarts to put a little 9? Oh, and I'll promote 988 if it's going to help people go to the right resources. We just need to.
Yes, and what you're talking about is not reinventing the wheel, just moving it to the next level, right? Yolanda mentioned the wording on that, not asking if you're a veteran, and you've got the Governor Suicide Challenge that's, working on that. They have the marketing materials. Are we all sharing it? Are we all elevating this? Not just when someone asks for help, but so that it's there, even that they go, I know I've seen this before. I know I've heard this before. Where have I seen it? You've seen it multiple times. It's in there. So when somebody does need help, you know exactly where to go. Sorry, I thought I saw someone else unmute really quickly, but please, y'all, please, this is the part where we want to hear from you. Lisa, I see you coming in and out of camera. I don't know if that's your in the room hint that you want to say something, but please feel free to unmute. All right, I'm gonna start calling on folks because I saw Leah nodding several times too.
Once again, Cynthia, you've done such an outstanding job. Everybody gets the whole picture.
You just, what you shared just really resonated with me, especially hearing that recovery centers were not screening for veteran or military status, because that's something that has been incorporated in part of our goals in trying to screen for different risk factors related to substance use and mental health and suicide risk. Trying to encourage where we can in our programs that folks screen for veteran status. And I'm wondering maybe if any of you experts on the call have guidance on the best way to do that. At what point in engaging with a patient do you wait to develop a relationship if people are hesitant to self-identify? Do you do it right off the bat at the first, with the first questionnaire? I'm wondering if you have guidance that maybe we can pass on to some of the recovery centers that we work with.
Leah, I'll just jump in. I would say it's great for the first intake as part of your intake. But one of the things Stan mentioned is when it comes to asking if they have veteran status, instead ask them, have you ever served in the armed forces or United States Armed Forces? And if they say no, then you just move on with your questionnaire. But if they say yes, if you could dig in a little bit more to some of the details regarding their time in service, there's a couple of additional questions that you could ask just to get clarity if they are, accessing VA. If they say, have you enrolled in VA healthcare? Yes or no, that can also help you understand if maybe they need to be also connected to the VA. And then I would say, if you can also add a question, if their family member is a military or veteran connected individual, because sometimes people can also be connected to services if their spouse or their parent or their especially that kind of nuclear family is connected to a military or veteran. That way they could be accessible to more resources.
Yeah, that's something that I feel like in some of our programs at the health department where we engage more with youth or the school system, we end up finding out that it is a military family that we're engaging with, but the only way we know that is through hints with insurance barriers that people are encountering, places they've already gone to try to access services. And so it's almost like doing detective work to try to figure out what other kind of military community resources we can connect them to better support the family.
Another aspect that we are going to go looking into, we meet once a month, approximately once a month. In our next meeting, we're hoping to have an individual from the Delaware VA Police Department. And then another individual gave a presentation at Frederick. So getting law enforcement to recognize also their role and opportunity to assist our service members, their veterans and their families is crucial. Whether, I don't care if we can give them a little card, again, I'm going to be promoting this concept that says, if you are a loved one serving in the armed forces, are you aware, contact 988, go to the VA. I don't care what it says, but giving it out to the family member when you're responding to a call would seem to me to be a no-brainer.
Tom, I saw you were unmuted. Didn't know if you want to jump in.
Yeah, I wanted to comment on the issue of identifying as a veteran. We certainly recognize that issue at the American Job Centers. And we try to train everybody, try to train the front end staff to move away from using the term veteran. We've had some veterans come in and say, well, I don't consider myself a veteran because I didn't serve in a combat zone, or I didn't serve during a time of combat. So I don't know why there's so much confusion about it, but I would definitely advocate the approach that we've talked about here. Did you serve or did family members serve? And I guess while I have the floor, Stan, I wanted to ask a question about the delay time. Are you talking about VA programs and delays in getting into VA programs? Or are you talking about other?
Well, we requested through our connections and sent out a form to the VA medical centers. So we were talking about the VA medical centers. Because when you first walk in, and I'm not talking about the vet center. Stephen, did you hear me? I'm not talking about the vet center. We go back a few years, to say the least. Anyway, you have to, first thing to ask you is, are you enrolled in the VA healthcare program, VA healthcare? And if you're not, you have to get enrolled in the VA healthcare.
Sure.
Then the second thing is, once you're enrolled in VA healthcare, then they're going to have someone connect with you to triage. Then maybe later on, they're going to assign you to outpatient counseling, or depending upon what the situation is. So our time frame that we, and this survey was done, I'd say about a year ago. It's in our interim report, which showed an average of about 2 to 3 weeks for an individual to actually get into a treatment program.
Now, so that's somebody who, I mean, if you're enrolled in the VA system and you go to the ER, or somebody brings you to the ER for a substance, you OD'd, or you've been drunk for 3 days, those people get immediate service. But you do have to, physically show up there.
You're talking about the VA Medical Center.
Yes, yes.
Okay. Because as I said, if, however, you go to a regular hospital, they don't even know if you're a veteran or not.
Right. Agreed.
And that's the key, is that being a veteran, you have access to other resources that are accessible only to veterans. And if you take advantage of those, you free up all the other beds, all the other rooms, all the other services for everyone else that doesn't have that access.
Sure.
So it's more than just beyond this, but yeah. And it was one of those things too, Tom, that it wasn't just the VA system. And I wish I had the numbers in front of me, Stan, in terms of even some of the other folks, that they were just getting flooded. And it goes back to Stan's point about you don't have enough providers to be able to provide that service. So no matter how badly they want to do it, no matter how high the quality is, you just don't have the supply to meet that demand.
In fact, when we were doing our presentation, and I won't say where, one of the VA, and I won't say what it was, said they were trying to hire 2 new counselors. They couldn't find enough people. And that's why I'm continually going to be promoting the concept of a summit to put together the idea of finding corpsmen, medics, psych techs who are coming out of the military, get them the 2 1-year set, whatever number of credits they can get. And maybe they can also be assigned to a recovery and treatment center and help do the case management approach. And that way you respond to 2 things. One, you help fill some of the gap, but more importantly, we're also going to get them employed when they get out. So that's another, again, I'm not saying that's the only way to go, but I know if nobody's ever heard of a thing called a cool credentialing opportunities online, Army, Navy, Air Force, Marines, they all have it. I know the person who is the CEO, and she gave a presentation to our group about connecting the resources.
Yeah. And again, it was a different stand too of the, can I get to there? Like Tom was saying, physically reporting, right? Can I get to Martinsburg? Can I get to there? And so it's getting all y'all's mind in the room and going, how do we connect all these dots? Nicole has been so patient up there in the upper right-hand corner with her hand up. Hey, Nicole.
Hey, thank you. So I had a couple of different questions. I wrote them down so I wouldn't forget them. So the first question, I know Stan mentioned, it's more important to say that you serve in the U.S. Armed Forces, but for the spouses that also qualify for some of these programs, is the secondary question, has your spouse served in the U.S. Armed Forces, right? So typically, it's that second part that may get to that dependent that may also need to be in a particular treatment program. The second question I had, I think Stan already answered that you must be enrolled in VA healthcare for some of these programs. The third question is in terms of active duty, because Stan had spoken about some of the concerns that active duty, but I'm thinking not only for them, but also for some of the veterans, are there concerns about confidentiality? Is that perhaps why people may be a little hesitant to say that they're either a veteran or they're currently serving? And to what degree is their status kept confidential? I mean, are there real concerns that would cause someone to have that hesitancy?
Well, I think Yolanda with Blue Star might be able to give us a little bit of information, but I will say to you from my own experience, if you're a service member, you're concerned with your security clearance, especially if you're in the area where we are. And 2, you're also concerned with promotional opportunity. So confidentiality becomes clearly an important part of that. And
Mhm.
so I remember sitting through a discussion with a person from one of the military installations who said, I think it's great, but I need to know if they're receiving treatment. I'm going, they ain't gonna let you know. Why would they? Come on, open up your eyes. You want to see, you want to help them to deal with their stress. So one of the ways I always said was, well, maybe if serving together and the cone talk about the military spouse, they will also be able to impact the military person. Think about it that way. So
Okay. All right. I did have one final question. So is there anything that I can do in terms of like the platform that I have? So at UMGC, we have a veterans Facebook page, we have a military spouse Facebook page. And to get the word out about some of these programs, is there some information that perhaps Stan or Yolanda, Christy, Cynthia, whomever that could perhaps provide that can alert people that these resources are available when they may not think that they have a confidential resource that is available to them?
Yes, 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 and yes. Go ahead, Yolanda.
So I think that leads into what Dr. X has asked, what is our gift? So Nicole, that's perfect, perfect alignment. What is our ask of the group? I think the continuous information sharing is going to be really handy. But one of the things that I'm working personally and professionally on for Blue Star families, and just listen as I say this, Blue Star Families is a happy organization, if you will, right? We're connecting families, we're having programs, we're having events, we're having all sorts of things that convey and portray happiness. However, there is an underside to, it's life, right? And so as we go through, what I'm doing is having discussions with our internal leadership to say we must be transparent with the cycle of life. And so the gift that I just got from everyone is more information. And I love the Ask the Question campaign. So all I can do is continue sharing information. What Stan alluded to earlier is for the past 2 years, whether I was working for the Veteran Staffing Network or Blue Star Families, we have been approached to assist and with circumstances, and we rely heavily on our Headstrong colleagues, our Cohen Clinic, any of those. And so again, I am honored to know each and every one of you all and the work that you all do.
Fantastic. Thank you. Stan, Cynthia, anything else you want to share with the group?
Well, the only thing I want to make you people aware of, we're continually going to market this concept of working in the local area. This is one of several we've done. We're going to do at least, hopefully with Christy's help, I'm even going to go into Northern Virginia and talk about it. Because if we don't talk about it, it doesn't get the word out. It's really the marketing, and then where do I go? As I said, when we talked to some of the medical center folks, they didn't know about the Cone Clinic. They didn't know about serving together. And even if they knew about it now, or I should say 3 months ago, you got to continually remind people of the resources that are available. That's why these collaboratives are so important, to continually remind each other of what we're here to do. And last but not least, I'm going to work on this summit. I'm going to get it done. I don't care what happens. We're at this point in time where we just think it's a crucial component to do something, not just to say, oh, it's too bad substance misuse and people dying is increasing. No, it's not too bad. It's too bad we're not doing enough. That's my thought. And I can tell you, I'm a Vietnam veteran. I came back and I did my drugs. You know what? I survived because of a lot of help from a lot of people. And that's what we've got to do. And thank you very much for the opportunity, Dr. X.
Yeah,
Thank you, Stan.
Only thing I've got is if anybody has any questions, comments, something comes to you later, I'm throwing my contact info in the chat. Feel free to reach out, even if it's an incomplete thought, even if something didn't make sense. Anything and all the input helps us make this better.
Thanks, Cynthia. Thanks, Stan. Outstanding presentation, very helpful. We have about 5 more minutes for anyone who wants to share information about their organization. I want to be mindful of everyone's time and try to end at 10:30, but does anyone have anything they want to share?
I wanted to kind of plant a seed maybe for future conversations in terms of Howard County specific services. I'm working with the police to do some targeted outreach around ERPO and red flag laws and extreme risk protective orders for folks who own firearms, but also we're looking to try to build voluntary out-of-home safe storage options in Howard County so that folks don't have to give their firearms to the police. So in the future, I would really love to, hear back from some of you all about what you've seen locally in terms of firearm ownership among veterans. Is it higher than the civilian population? I'm just trying to figure out what the best angle is to do some targeted outreach with folks. So I just wanted to kind of plant that seed because we're still in the early stages, but the police are very interested in doing some partnerships more with the veteran community in Howard County.
And to add to that, Leah, remember we did hand out locks, gun cabinet locks at one of our events. So in a not too intrusive way, educating that we need to be practicing safety.
Thanks for sharing.
I'll add just quickly to that. I know another item that I believe the VA is working on is the suicide prevention coalitions and doing lethal means safety trainings and things like that for the community. So that's something that we could also potentially bring to a future collaborative meeting or help investigate ways to provide that out to the community to allow for more understanding of the value and importance of lethal means safety.
Thanks,
that would
Krista.
be great. Thank you.
Awesome. I think we have time for one more question, comment, remark.
Hey, everybody. My name is Steve Pfeiff with the Dundalk Vet Center. I just wanted to let everybody know that starting August 1st, we are establishing a community access point where we'll be providing counseling services at the Fort Meade Reserve Center off 175. So we're finally going to get something right there around Fort Meade because we've had 4 vet centers that kind of provide services, but nothing closer than a half an hour. So right there at the Reserve Center off 175 starting August 1st. So I'll push out some flyers for y'all so you can let your networks know. But just want to let everybody know that since we're, right there at Fort Meade, it's like that's where everybody is, but we don't have a vet center. So hopefully we're trying to transition closer to that area.
That's outstanding. Thanks for that announcement. Appreciate it. Stan?
And if you would like to respond to our presentation, give us some clues what we need to do better, I'd appreciate it. I used to work in the DOL Vets National Office, so I have no editorial pride. So any comments to make this better and move it on, I'd appreciate it.
Fantastic. Anyone else? All right.
Sorry,
Rochelle.
I want to share real quick. I just want to let everyone know, I applaud you all in your efforts. I'm new to Tower, but this really hits home for me. My dad was a veteran and he came home from Germany and unfortunately he passed away. And then my stepdad is a veteran Navy, and a lot of times these resources are unknown to them. So being able to find ways to share is important, but being 22 years of working in the DoD industry, I find that it is important to kind of find that safe haven or maybe that veterans employee resource groups or a wellness piece of it where we can present it to these DoD employers to share these opportunities, and therefore the employees don't feel threatened or the thought of, because a lot of times you do have many of these problems, but the employees are scared to step up because they don't want to lose their income or their benefits with their employers. So the one thing that hit home for me was like safe. How can we share it safely? How can we share with the organizations? And then how can we get them to stand by their fellow veteran employees and help, get them over the mountain to the wellness side. So something I would love to talk about because I'm really passionate about this, and I do a lot of work within the DoD industry of employee resource solutions and help. And I think this is so much needed, and a lot of times it's walked away from or it's hidden underneath the rug because to them it's not safe. That's all I had to add.
Oh, that was,
There's some big champions in DoD right now, especially in leadership, like SEAC, the senior enlisted advisor, the chairman. If he's a great follow. Also, there's at the top. I know everyone says it starts at the top, but it doesn't. Everybody affects the culture, so everybody can contribute to it. But there are some great leaders that are really making that change and really destigmatizing, getting the help you need to be a more productive, to be more whole, and contributing to national security and readiness. So getting there.
yep, getting there. Fantastic. Hey, well, thanks again for carving out time in your morning. Truly appreciate it. Hopefully you got something out of it. It seems like you did. And looking forward to linking up with you next time. Take care and make it a great day out here.
Thanks, everybody. Take care.
Thanks.
Thank
Bye.
you.
Just saving the chat real quick.